We're going to pick up here talking about some of the different types of synovial joints. So we have bursa, tendon sheaths, and fat pads. And you can find these actually kind of helping to support synovial joints. Bursa are basically like little water balloon sacs of synovial membrane that are filled with synovial fluid. And you find these bursa in a lot of different areas, between muscle, between skin and muscle, between bone and skin, between muscle and bone. Places where tissues might rub together, you can find bursa there. Okay. So one place that I used to get this a lot when I first started teaching was on my elbow here. There's actually a little bit of bursa between the skin and the bone of your elbow. There's a little bursa between there. That way when you're moving your elbows, you know, your skin's not just rubbing up against bone. So there's actually a bursa there, and I used to actually have my elbows on the table a lot while I was preparing for lectures and stuff. And I had my elbows on the table so much it caused that bursa to get inflamed, and I had what they called student's elbow, which is basically where the bursa gets really large. You get these big fluid-filled kind of cyst-like structure on your elbow. I know.
Like full of pus?
No, it's just filled with synovial fluid.
Oh.
But it's just like an inflammation of the bursa. So if you guys have heard of bursitis, that's basically bursa inflammation. Tendon sheaths surround tendons, and so it kind of makes sense because if you look at any tendon in your body, like especially the tendons of your wrists, so if you wiggle your fingers and look at your wrist, you can see that on your wrist there's a lot of tendons just kind of wiggling around underneath your skin, right? It's kind of weird looking actually. And so what this means is that these tendons, they could potentially rub up against each other or other nearby tissues, but instead what happens is these tendons are wrapped in a sheath, a tendon sheath that helps lubricate that tendon and prevents friction. If this tendon sheath doesn't function properly, that's what can lead to tendinitis. In fact, tendinitis in the carpal area we call carpal tunnel. It's where it's like if you're using your wrist a lot or if you're using your fingers a lot, like you're typing or something, that can lead to tendinitis in the carpal region, which we call, what's that called again? Carpal tunnel, thank you, yeah. I just said it. You also find fat pads, which function as a packaging material. And these fat pads help like just basically cushion between joints as well. So let's check out some examples. If it surrounds a tendon, what's that called? Tendon sheath. You can see that here. So all these tendons in your body have their own little tendon sheath so that the tendons actually move within a fluid-filled cavity. That way they're not rubbing up against nearby tissues. We also find here, you guys, in the knee joint, we got some bursa. So here's a bursa there. We got some bursa over here as well. And what happens is these bursa are like, there's these things called water wiggles, and I didn't know what they were called at first. I had to look it up. I used to just describe it. But a water wiggle is like one of those little toys that's like, it's a like rubbery kind of plastic that kind of folds in on itself, and it's full of water. And you try to grab it, it just kind of slips between your fingers, right?
Oh yeah.
Your hands,
I know what you're talking
and you
about.
can't really grab it because it just kind of keeps flowing, you know? And you're like, I can't grab it. So that's a lot like a bursa here. In fact, bursa rolls in a joint like those things would, right? You might
So
want to.
it's like surrounding itself. In other words, like the fluids on the inside, like those.
Well, it kind of just rolls with the joint.
Okay.
It's not structured like that water wiggle necessarily, but it has the same function in the sense that it's hard to grab onto and it kind of roll in the joint. And so by rolling around the joint, then it prevents friction along like tendons and muscles and that kind of stuff. So you find bursa in joints that move a lot in between tissues that could potentially rub up against each other. And they also some fat pads too, guys. So you can find adipose even like around tendons and stuff like that, or even around muscle. So just they kind of function as like these little fatty pads. Now, for the different types of synovial joints, we have uniaxial, biaxial, and multiaxial. A uniaxial synovial joint is where you have one plane or axis. That's where it moves. A biaxial is where it moves in two planes or axes. And multiaxial is basically where it has like more than two planes, right? So three or more. So an example of a uniaxial joint is a hinge joint. Hinge joints move in a hinge-like manner, like your knee joint is uniaxial, because your knee only moves in one axis, right? It's a hinge joint, bless you. Biaxial joints can move in multiple planes or axes, and these multiaxial are more freely movable, like your shoulder joint would be more of a multiaxial type of joint. So what this slide is showing you guys are the different types of joints. We got condylar joints, which you find where you have kind of a convex rounded surface that fits into a concave rounded surface. One place you find a condylar joint is interphalangeal. So between, or also phalangeal metacarpal, so between your fingers and your metacarpals, that's condylar. So condylar can move in many different directions, right? You can go up, down, side to side, back and forth. So that's multi-axial joint. That's a condylar joint. Okay. We can also have plane joints, where basically bones can kind of move against each other in multiple planes. Okay. These can be biaxial. Now, a hinge joint only moves in one direction. So this is an example of a uniaxial joint. And one of the most freely movable joints is this ball and socket joint, because it actually looks like a ball going into a socket. So you have the head of the femur, or the head of the humerus, and it goes into a socket end, right? They form a ball and socket joint, which is the most freely movable. It's definitely multi-axial. And if it's the most freely movable, what does that mean in terms of its stability?
Less stable.
It's the least stable. You got it. So these ball and socket joints are the ones that are most likely to dislocate. So examples of ball and socket would be like your hip joint and your shoulder joint, or glenohumeral joint. Those are examples of ball and socket joints because the ball can actually pop out of its socket and dislocate. Okay. You can also have pivot joints. These pivots can kind of rotate along a certain axis. So right where atlas and axis meet, that's actually a pivot joint. So atlas actually rotates around axis. So when you move your head side to side, it's sort of pivoting or rotating around that particular joint. So when you go, I don't know what a pivot joint is, right? You're doing it. So there's different types of movements at synovial joints, and we'll go into a lot more detail on the specific names for these movements, because when we talk about muscle, starting next week and the following week, we'll talk about the actions of muscle and how muscles help move joints. Remember, one of the functions of your muscular system was to move your body around. Well, the only way to move a body is to move the joints in that body, right? So, in terms of the different types of motions, we can have gliding motions, angular motions, rotational, and special movements. So what this table shows then are all the different names of these movements and the definitions of each, but we'll just go through these together, okay? So let's first talk about the gliding motion. So gliding motion just basically occurs between plane joints, and you're going to find this where bones kind of glide against each other. Where you find gliding motion is between your carpals. So if you're moving your wrist side to side, that's a gliding motion, okay? And so it's where the angle between these bones doesn't change, but rather the bones just kind of glide against each other, okay? So moving your wrist side to side is more of a gliding motion. Now, these are the terms we'll use to define angular motions like flexion versus extension, hyperextension, and lateral flexion, abduction versus adduction, and circumduction. So flexion, if you guys look here, see how he's kind of tilting his head down? Flexion is where you decrease the angle at a joint. So you make the angle at your joint smaller. So if the angle was between his chin and chest, if you move your head downward and your chin is now touching your chest, that's considered flexion because you've made that angle smaller, right? Instead of being like 180 degrees, now it's maybe like 20 degrees or something, okay? So that's considered flexion. Extension is the opposite. So extension is actually increasing the angle of a joint. And if you go beyond the normal anatomical position, we call that hyperextension. Like looking upward will be hyperextension because you're extending your neck beyond the normal anatomical position. So when you guys think of like hyperextension of the elbow, what comes to mind? Yeah, like it's way too far extended, right? And it even hurts a lot to do that. So remember, the normal anatomical position is when you have your arms outstretched. But if you actually bring your forearms and hands closer towards your body, that's flexion, because now you're decreasing the angle between your forearm and brachium, right? It makes that angle smaller, that's flexion. But what if you go back to the anatomical position? That's extension, very good. And then what if you keep going and to the point where now your forearm is sort of beyond the anatomical position? That's hyperextension. Now it's hard to do it with your arm because it hurts too much, right? The olecranon kind of blocks the way. Yeah.
I had a question. So when people, like I had a friend in high school, when they say like they're double jointed or whatever, and they can like, how can they do that?
There's people who are double jointed. It's kind of a misnomer. It doesn't mean they actually have two joints, but it means their joints are more flexible. You know, kids often have more flexible joints, but that double jointedness, sometimes there's connective tissue diseases that are associated with that. Like if someone has weaker connective tissues, their joints can be more flexible. And you might think it's like a good thing or a bad thing. Or maybe it's good if you're a gymnast or something. But it's bad because that decreases the stability, right? If your joints are more mobile, they're less stable and more likely to be injured. So people who are double jointed, I would guess, are probably more prone to joint injury because their joints are more loose. That's a good question. Yeah, I had some friends like that too. They could like move their arms in really weird ways that seemed kind of like it looked painful, but they were never in pain about it. So, so flexion is decreasing the angle at that joint. Extension is increasing the angle at that joint, right? The joint is the elbow joint here, right? So, what about with the wrists? What if you brought your wrist kind of upward? That's flexion, right? Because now you're decreasing the angle between your wrist and your forearm. What if you brought your wrist downward where like you can show your palms to somebody? Yeah, that could be hyperextension. And if you go back to the normal anatomical position, that's considered flexion, right? And what if you go back the other way, where now your palms are from the flex position back to normal anatomical position? Extension. Very good. Same thing with your knee joint, you guys. If your knee joint moves towards the posterior direction, you decrease the angle at this joint. What's that called? Flexion. And if you increase the angle, extension. And then if you keep going beyond it, it's hyperextension. I can't really show you guys that because it'd be too painful, but you know what I'm saying. Lateral flexion means you're bending to the side. So if you bend your trunk to the side, that's lateral flexion. Okay, either way, lateral flexion. So you're just sort of decreasing the angle right here on your side. Okay. Now, what about abduction versus adduction? Abduction, or I call these like abduction or adduction because the words sound very similar, right? Like abduction, adduction. They sound very identical. So I'll say abduction, adduction. Abduction is we can move a limb or a body part, farther from the midline, right? So if you can move your arms away from your body, that's abduction. And if you move your arms closer to the midline, like you're adding your arms to your body, that's adduction. So what if I move my leg out away from myself? Abduction and adduction. Good. How about with my thumbs? What if I move my thumbs outward? Abduction. What if I move my thumbs back? Adduction. Good. Makes sense. Because adduction would be like moving it closer to your body. Abduction kind of like away from your body or away from the midline. All right, cool. So same on your hands too, guys. Now on the hands it gets a little weird because you notice that when the pinkies are also kind of being extended. Although when you move your pinky away from the rest of your hand, that's still considered abduction. However, due to the location of your pinky in the normal anatomical position, it looks like you're going closer to the midline of your body, right? Like if I move my pinkies out like this, right? It's almost like it's going closer to the midline of my body, but that's still considered abduction because it's in reference to the midline of your hand. It's the reference to the midline of your hand. So it's this abduction of your fingers, adduction of fingers. So spreading your fingers apart, abduction, putting them back together, adduction. And there's actually specific muscles that do all these for you. What's nice is that often the name of the muscle tells you what it does. So you have things like adductor longus. Guess what that does? Well, it adducts something, right? Or you have another one called like abductor pollicis longus because it abducts your pollex, or basically your thumb, right? So you have one muscle whose sole purpose is to abduct your pollex. It's kind of cool. Called the hitchhiker's muscle. So what about circumduction? Well, circumduction is kind of a mixture of those types of movements. So circumduction would be like if you can draw a circle with a limb. That's circumduction. Okay? Or your leg, too. It's a little harder with my leg, but, this is circumduction. Which would require a little bit of a mixture of things like adduction, abduction, flexion, extension, right? So it's a mixture of those types of actions. So that's circumduction. And then what about the rotational movements? For rotational movements, we have lateral rotation, medial rotation, pronation supination. Lateral rotation means you're rotating something laterally or away from the midline. So what if I did this? Lateral rotation. And if I move my thigh back into position? Medial rotation. So lateral rotation, medial rotation. What if I did this? Lateral rotation, medial rotation. Very good. What about lateral rotation, Medial rotation. Good. What if I look down?
Flexion.
Flexion. That's flexion. What if I look back up? Extension. Hyperextension. What if I move my trunk that way? Lateral flexion. What if I just move my trunk all down like this? Just flexion and extension. Good. What if I move my leg outward? Abduction. Adduction. Good. And then what if I did this? Just kick a soccer ball. Lateral rotation. Thank you. Yeah. Lateral rotation, like you might kick a soccer ball with the inside of my foot, right? So lateral rotation. There's a little something else too, but we'll go back there. Medial rotation is just the opposite, right? So if you're not laterally rotating, then you're medially rotating. What about pronation versus supination?
Pronation is when your thumbs down and supination is up.
Good. So let's check this out, you guys. So they're showing lateral rotation of the thigh, medial rotation of the thigh, and rotation of the head at the neck. Same with the arms. You know, if you move your arms out like that, that's lateral rotation, medial rotation. Okay. But what about for the entire arm? We have different words. We say pronation, supination. Okay. So if you're in this position, then you are supine. Like the anatomical position is supine, right? If your palms are facing outward, that's supine or anteriorly. So to turn your palms posteriorly means pronation, because now you're going into the prone position. Okay? And then if you turn your palms anteriorly, that is supination, because now you're going in the supine position, right? So this is pronation, this is supination. Good. So pronation, supination.
Supine?
Yeah, if you're laying on your back with your palms facing up, that's supine.
Oh, okay.
Yeah. If you're laying face down with your palms facing up, that's prone.
Okay, yeah.
Yeah. But don't worry about that. Just for this, for the sake of this, you guys think palms facing anteriorly, supine, palms facing posteriorly, prone. But in terms of these activities, if you're turning your palms anteriorly, we call that supination, because you're becoming in this supine, right? If you turn your palms posteriorly, that's pronation. Good. And guess what? We actually have muscles for that. I remember being an anatomy student and like going and playing foosball a lot one night. And what do you do with foosball? You do a lot of that, right? Like wrist movements. And it's a lot of like pronation, supination kind of stuff. And I was playing foosball like in hours, and the next day my forearms were killing me, even both sides, because there are specific muscles that are involved with supination and pronation. And so like my supinator and pronator teres were like really sore the next day. And I remember being an anatomy student thinking, hey, I know what that muscle is. Like I know, hey, that's supinator, that's sore on me. That's pronator teres. It's actually kind of cool. Someone had a question. Yeah.
I was wondering, are you laterally rotating your palms at the same time going between supination and...
That's a great question. You can think of this as like lateral and medial rotation, but we use the word pronation, supination with respect to your forearm and palms. So although you could maybe say something like lateral or medial rotation, the problem with that though is that to be in the supine position is anatomical position, right? So to laterally rotate, you can go beyond that, which actually doesn't really make sense. You can't really go beyond that. Okay. So if you're in the anatomical position, then all you could do is medially rotate your palms. I guess you could laterally rotate back too as well. But we say supination, pronation. Yes, good thought. Okay. Now some other special movements, you guys, include things like depression, elevation. Depression is where you lower a body part. Elevation is when you raise a body part. So what if you're really shocked at something and you drop your jaw? Depression. And what if you're like, oh, elevation. Good. What if you didn't know what depression elevation was and you went, that's elevation, right? You shrug your shoulders, you're going up, that's elevation, and you go, that's depression. Exactly. Good.
So you're always in like this is.
No, like going back down would be depression.
Okay.
Yeah.
Movement.
Yeah, exactly. So elevation, depression. Exactly. So depression, elevation. Good. How about dorsiflexion versus plantar flexion? Well, dorsiflexion means pointing your toes up towards your face. Plantar flexion means pointing your toes downward. So if you're pointing your toes up, like if you're walking on your heels and your toes are pointing up, that's dorsiflexion. Like let's say if you stepped on something sharp and you're like, ah, and you're walking around on your heels, right? You guys have done it before? I have, definitely. And then what if you're like walking your tippy toes for some reason? Plantar flexion. Good.
So if you point your toe, is that plantar flexion?
Yeah, if you point your toes away from you, that's plantar flexion. But if you point your toes up towards your head, that's dorsiflexion. So what about inversion versus eversion? Well, inversion means turning the sole of your foot inward. So if you kind of turn your sole of your foot inward towards your midline, that's inversion. Eversion is when you turn the sole of your foot outward. Okay, so inversion, eversion. Protraction versus retraction. These are kind of fun, actually. So protraction means to kind of jet something out away from your body. Retraction means to bring it back. So what if I went like this? Protraction and retraction. What about my mandible? Protraction, right? Retraction. And then the last one here, guys, is the stoner's favorite action. Opposition. It's where you have opposable thumbs, right? So it's like where you can grasp something with a thumb and finger. So opposition is the stoner's favorite, right? I've got a good story for that, by the way. I'll just tell you guys. So I had a student, like probably my third semester ever teaching. He didn't want to learn the names of muscles. He wanted to learn all the muscles as numbers. So all the arm muscles would be like 4 dash something. So instead of saying biceps brachii, you'd be like, oh, that's 4-1. Or instead of saying triceps brachii, you'd have like 4-2. So, like, he didn't want to learn the names. He was actually memorizing these by the numbers, and then he would memorize what numbers matched up to what names. That's how he thought. So, we got to a muscle in the hand, which was opponens pollicis, and it's involved in opposition, right? So, you kind of have opposable thumbs. I said, okay, well, what's that muscle's number? It's like, oh, that's 4-20. Right? Genius.
Never forget it.
So if you raise your shoulders, elevation, lower, depression, good. And what if you jut your jaw out? Protraction. Right. Oh, that smells bad. Retraction. Or tastes bad. How about if you turn the sole of your foot inward? Inversion, outward. Eversion. Good. How about if you point your toes upward towards your face? Dorsiflexion. And if you stand on your tippy toes? Plantar flexion. Good. And the stoner's favorite? Opposition. Right? It's also something that's really cool. I mean, like, it allows us to grab things. Like, think about a dog or other animal. Like, they can't really grab things with their paws, right? They don't have opposition. You know, other primates do and humans do. So we can actually grab things really well and use our hands to make things. So it helps make us human. And if you think about it, like that simple action, because we have opposition, not just the stoner's favorite, but because we have opposition, it's allowed humans to actually make things and like make a society beyond just, living in the woods.